So Hashimoto's, okay, or autoimmune thyroid is the #1 cause, all right? But there are other factors that can lead to hypothyroidism, all right? So we look at the toxic load, or we look at somebody with hypothyroidism. Like I said, 90% of people with hypothyroidism or low thyroid function in the United States have an autoimmune condition known as Hashimoto's, all right? But there are other factors that can lead to hypothyroidism as well. So what we're going to do is talk about these. We're going to talk about the 6 major patterns of low thyroid function. Right? So the first one is primary hypothyroidism. This is a true dysfunction of the thyroid gland. All right? This is where your thyroid gets lazy, so your pituitary gland tries to kind of ramp it up or give it a kick in the pants by pumping out extra TSH to get your thyroid to start working a little bit more efficiently or a little bit stronger. All right? This is great. This is where Synthroid and those medications work awesome. Okay. Now, if you have this and this only, you're not here tonight. Okay. You're not watching one of my DVDs or coming to one of my talks. All right. You're doing great. Your Synthroid is keeping everything in check, and your symptoms are gone, and they're staying gone. Okay. Now, you can have this along with Hashimoto's. You can have this along with maybe another pattern, which is causing breakdown. But this is where I tell patients, my goal is not to get you off medication because you have a primary hypothyroid problem along with Hashimoto's, or along with a underconversion, or along with this toxic load. Okay, so realize my goal is not to get you off medication, not to reduce your medication. If that happens, great. All right, but most thyroid patients do have a primary hypothyroid problem. All right? So the only pattern of hypothyroidism that can be managed effectively with hormone replacement therapy, okay, unless it's an autoimmune disease like Hashimoto's. Okay, so primary is the only one that Synthroid really works well with. Okay, so what do we see on blood tests? We see your TSH level elevated. Right? From a conventional standpoint, they give you medications like Synthroid. Right? However, your doctor probably doesn't screen for Hashimoto's because it's not going to change their approach. Okay? From a functional perspective, what we do is we provide nutrition support for the thyroid. We rule out Hashimoto's through running an antibody test. Okay? If Hashimoto's is detected, all right, the condition can be reversed if too much tissue has not been damaged. Okay? It can be really dampened. Okay? Immune response can really be calmed down quite a bit. The second pattern is hypothyroidism secondary to pituitary hypofunction. This is the opposite. This is where your pituitary gland gets lazy or gets fatigued, and TSH production is low. All right. This typically happens due to chronic stress, typically due to a lot of coffee, busy lifestyle, diet, inflammation, infection, you name it. Okay. Your pituitary gland just starts working really, really slow and not pumping enough TSH to the thyroid gland. All right. This can also happen due to postpartum depression. Pregnancy amplifies the demand on all hormones, so it can fatigue the pituitary, because your pituitary doesn't only talk to the thyroid gland, it also talks to reproductive organs, and it talks to the adrenal glands, so your pituitary can get really, really fatigued. All right? So, hypothyroid symptoms treated with hormones, even when blood tests are normal. All right? So, your medications with this presentation can actually make you worse or cause the pituitary gland to fatigue it even more so. All right? So what happens is you take more and more medication, you actually start developing a resistance to thyroid hormone, all right? And then your pituitary, through those feedback loops, actually just starts shutting down, okay? It stops working. So on blood work, we see low TSH, typically below 1.8, but not below 0.5 to where somebody would think that it's Graves' disease. It's just a continuously functionally low TSH. From a conventional standpoint, really there's no treatment for this presentation. Your doctor may prescribe hormone due to your symptoms, but like I said, if you continually take those hormones, it's going to actually in time create that pituitary gland to fatigue and fatigue more where it stops working. From a functional perspective, we rule out Hashimoto's or autoimmunity. We look for the toxic load or stressors, remove them, and then as well support adrenal and pituitary tissue nutritionally. Okay, so we've got to do some type of nutritional support for the pituitary gland, and typically due to into the adrenal glands because of the chronic stress. The third pattern, Thyroid underconversion. Now this kind of wraps in what we're talking about with thyroid physiology, okay? This is where we're not making enough thyroid hormone, all right? The gland is making enough T4, so your thyroid is spitting out enough T4. However, the conversion from T4 to active T3 is decreased, so we're underconverting thyroid hormone, all right? We talked about it. It could be due to a bad gut, it could be due to a bad liver, it could be due to chronic stress. All right, so chronic stress causes the adrenal glands to pump more cortisol, which actually suppresses the conversion of T4 to T3. All right, free radicals from chronic inflammation, all right, damages cell walls, hamper the conversion as well. Okay, so you got to look at inflammation markers to see how inflamed you are systemically. On a blood test, your TSH is normal. All right, however, your free T3 and your T3 are low. Okay. Now, your doctor, it's not going to change their management because there's no medications to affect conversion. Right? This is often missed because T3 does not affect TSH directly. So the conventional approach, no treatment because your TSH is normal, right? Or they may prescribe hormones because of your symptoms. Because you have all the symptoms of a patient with thyroid, but hey, let's give you some Synthroid to see how you do, and maybe you do good for a few months, but then you're right back there because maybe the problem with the liver or the chronic stress or the inflammation or the gut was never addressed or fixed properly. From a functional perspective, we rule out autoimmunity, such as Hashimoto's. We test for stressors and causes of inflammation, remove those stressors. We provide nutritional support to reduce the inflammation, improve antioxidant status, support T4 to T3 synthesis. Okay, so we got to look at those other things through proper testing and why you're underconverting, and whatever we find, hey, we support that nutritionally and improve that conversion rate. Now the opposite is thyroid overconversion or decreased thyroid binding globulin. Okay, this is where we're making too much active T3, so our cells actually start getting overwhelmed and actually build up a resistance to thyroid hormone. It's very similar to somebody that's insulin resistant. Okay? Or you can have too much thyroid binding globulin, which means there's too much free T3. Or too little thyroid binding globulin, which means that there's too much free T3. There's not enough taxi cabs to take the hormones where they need to go. Okay? This happens due to insulin resistance, can then lead to thyroid resistance. Polycystic ovarian syndrome causes increased testosterone levels in women, resulting in too much T4 converted into T3, as well as too little thyroid binding globulin production. All right, so we got to look at hormones, estrogen, testosterone. We got to look at a T3 uptake. We got to look at your blood sugar as well as your lipid panels, and we got to look at your T4 and T3 blood markers to determine this pattern right there. All right, so on a blood test, your TSH is normal, your free T4 is normal. However, your T3s are high. Conventional approach, no treatment because your TSH is normal. Why are we going to give you Synthroid if your TSH is normal? All right? Or we may prescribe you Synthroid because you have all the symptoms of a thyroid patient. Okay? And you may feel better for a little while because you get that little bit of a boost and maybe conversion increases short term, but the problem was not addressed. The insulin resistance was not addressed. The increased testosterone was not addressed. There was no hormone clearance techniques used nutritionally to affect the conversion properly. Okay. So from a functional perspective, what we do is control blood sugar to reverse the insulin resistance issue. Okay. And in some cases, liver detoxification is needed. Right. Now, in terms of controlling blood sugar, to reverse insulin resistance, there's dietary changes. So we got to find out why you're insulin resistant. Okay. Is it your diet? Is it lifestyle? Okay. Do we need nutritional support along with lifestyle changes to do that? Okay. So what we do here is nothing close to cookie cutter. Every person is completely different. Everybody's toxic load is completely different. The fifth pattern is thyroid binding globulin. Okay, this is thyroid binding globulin elevation. This is where you actually have too much thyroid binding globulin in the blood, and because of this, you have too little free thyroid or free T3. You have too many taxi cabs or boats that these hormones never get off. All they do is when they get off, they hop on another boat. They get off, they hop on another boat because there's so many boats that go around that they can't get off in time to get out of the blood to get to a cell. All they do is they get attached right back to thyroid binding globulin. This happens due to typically oral contraceptives, birth control pills, estrogen creams, estrogen hormones. Okay, They cause an increase in estrogen, which leads to increased thyroid binding globulin production. Okay, so somebody maybe younger, they're on birth control pills. How do we, if this is what's going on with them, we've got to make the decision. Do we get off of that? Okay, if you're a little bit older, if you're using estrogen creams and this is what's going, hey, we got to figure something else out. We got to figure out how we can convert hormones more efficiently than using estrogen type creams. On a blood test, TSH is normal, free T4 is normal, okay? Free T3 as well as T3 uptake are low. So conventional approach, nothing because your TSH is normal, or they may give you medications because you have symptoms. Right? From a functional approach, always got to rule out Hashimoto's or autoimmunity, and then we clear the body of excess estrogen, okay? Provide nutritional support for healthy bile formation and liver detoxification. So hormone clearance through liver detoxification a lot of the times, and then make the changes if you're on birth control pills or if you're using estrogen creams or estrogen hormones, because if not, the problem's going to come right back. Okay. And then the sixth main pattern of low thyroid function is something we could call thyroid resistance. This is where your pituitary and your thyroid glands are fine, but hormones, just hormone level, blood sugars, everything's fine, but your hormones can't get into the cell. There's a resistance to thyroid hormone. Okay, so everything looks good in your blood work. Pituitary looks good, thyroid looks good. However, hormones are not getting into the cells. Because of this, you have hypothyroid symptoms. This happens usually due to chronic stress. Okay, chronic stress stimulates the adrenal glands to produce too much cortisol, which then causes cells to become resistant to thyroid hormone. Right. Also, elevated homocysteine or inflammation. Okay, genetic predisposition, hypothyroidism, and improper monitoring of your medications, your Synthroid, can lead to this. Okay, in time, those things can cause those hormones to not be able to get into the cell to perform a function. All right. So on blood tests, like I said, everything is normal. Everything looks good. All right. Conventional approach, nothing because everything's good, or maybe they'll give you some medications to improve symptoms because you have all the symptoms of a thyroid or a low thyroid patient. From a functional perspective, you got to rule out Hashimoto's or autoimmunity, all right? And then we address the adrenal function, all right? We address adrenal function as well as excess cortisol, as well as homocysteine and inflammation, okay? Because those typically are the things that will lead to thyroid resistance. So we'll possibly do a cortisol test. We'll look at homocysteine to see how elevated that is, and then do nutritional approaches to improve those functions. With that, the thyroid resistance changes and symptoms improve. Okay? So those are the main six patterns of low thyroid function. Very, very important because only the first one really has anything to do with Synthroid or a true thyroid problem. Okay? So it is imperative you got to look at an extended thyroid panel to determine if you fall into one or more of these thyroid patterns, or if there's, like I said, there's over 24 or more if you fall into more than the 6, or if you have Hashimoto's, and we got to look at where your toxic load is.